Welcome everyone to the pharmacy practice class for the final year students of B.Pharm. Myself Victor Roychowdhury, Assistant Professor of Department of Pharmaceutical Technology of JISU University, and today we'll be discussing about the hospital and its organization. So to begin with, we can say that the students will learn about the definition and functions of hospital in this class. They will have a knowledge how a hospital works and what are the functions, and they will have an insight on various departments in a hospital. So these are mainly the contents of this class. So first we'll be defining a hospital, then we'll be giving you a brief history about the hospital, how it worked, then about the hospital functions, the different functions of hospital, and then the departments of the and then we'll be giving you the departments of the. Then we'll be concluding this class, and after that finally we'll be there some questions for you. So to begin with, we can say that the hospital is defined as a healthcare institution with an organized medical and professional staff and with permanent facilities that include inpatient beds, provide medical, nursing, and other health related service to patients. So we can say that a hospital is an institution. It's an institution where there are the staffs who are working there are medical staffs, and they are thoroughly professional staff. So there are some permanent facilities in the hospital, that is like the inpatient bed facility where a patient it can be admitted in a hospital, and there are some other health related service that are the medical service, the nursing service, and other, that is the pharmacy service. Everything which is everything related to health are also provided in a hospital. So we can also say that hospital is a very complex organization with a specific aim of restoration and maintenance of good health. Now it provides special facilities like nursing, the dietary, the blood banking, the patient counseling, and skilled professionals and teams of physicians and surgeons for patient care. Now, if we move to the history of hospital, we'll see that in 1986, WHO, the World Health Organization, formed the Global Program Committee. The committee adopted a concept of district hospital system, which is based on primary health care and is a part of our national health policy. Of our national health policy. So if we move a bit before this, so how a hospital run started in India, we can see that hospital, in those days, it was said that the archaeological, the archaeology section of the Hindu temples started a very small bed-sized hospital. So it was looked after by few doctors who were given a small piece of land or paddy for their service, which they provide. So we can say that like the doctors who have been paid money for their service in the hospital in modern era. So in those days, the doctors were given a piece of land or some paddy for their service which they provide in the hospital. So disease which were commonly treated in those days were like asthma, fever, then pile and jaundice. Later on, these doctors, they adopted the Ayurveda system, the Unani, the Siddha, and the homeopathic system. So the doctors and the Hakims. Who are the Hakims? We can say that the people, the Hakims were one who visited a village and patients at their homes. So they adopted all these systems of medicine. So in this era, that is we can say that presently in this 2020, there was a huge advancement of medical science, and there was a huge advancement of the technology in the diagnostic aid and the surgical area. So these both combine a big, and this provide a big build-up for the good and ensure a good health for the society. So these are mainly the functions of hospital. So a hospital, we can say that it provides a preventive function, then a curative function, then a training function, and a research function. So each of these functions will be described in our later slides. So what is this preventive function? We can say that in an emergency, the secondary function for a hospital and concerned with the health promotion. So these are the secondary function of the hospital, and it is concerned with the health promotion. Mainly, it promotes health. So it promotes health for good health for the society. By organizing various types of various types of programs. And in case of emergency, this is this institution provides and supplies medicines. It supplies medicines to the community, or rather they supply medicines to the if we consider, let us consider a big hospital in our society, and then there will be some various small sub centers in the society. So these hospitals will provide the essential medicines like the vitamins, then some the iron tablets. All these things are provided to the sub centers to be distributed into the community. So these by this way, the hospital is also be performing as a preventive function. So it is, we can say that it is geared towards providing the preventive service through the community health center. So as I have said, how hospital provide the drugs to the health centers, and through the health centers, the various health workers, the house to house workers who have been working in the urban areas visit the house daily, and they provide the essential medicines to the needy ones. So and this one, and we can also say that it takes an active role to improve the health of the population. So if in a particular population there has been some disease, we can say that in some portions of our India, or in West Bengal, in some portions there are some districts where where the pregnant mothers are anemic. So hospitals, I can say that the hospitals are playing an active role to improve the health of such populations. So where a mother is anemic, the hospitals are providing the iron tablets, and that is free of cost to each and every patient, every mother. And by this way, they are playing an active role in the health of the population. So this is the primary function of a hospital, that is a curative function. So what this is a curative function, we can say that if a patient is having a disease, so he goes to the hospital to visits a hospital and gets cured. So it is a primary function of a hospital, and is concerned with providing the patient care. So it refers, we can say that curative function is, it refers to any type of care given to a patient by hospital team members. That may be the physicians, that may be the nurses, that may be the dietitians, and everyone who are the team member of this hospital, who provides a care for curing a type of particular disease. That is the hospital's curative function. So it also includes the health education to patients. So in the previous slide, I have said that it promotes the health, a good health to a population. And in this curative function, this hospital plays an important role by educating the health, educating the good health to the patient. So in this curative function, we can say that it also includes services for the diagnosis, the prophylaxis, and the treatment of disease to a patient. And inpatient service are equally important by providing hospitalization facilities. So it also provides immunization, that we can say that immunization, that was mainly, we can say that in the preventive function as in hospital. So immunization, it helps to prevent the disease. And the small unit is also run in the OPD section, where the children are immunized. They are immunized by giving different vaccines like the BCG, the hepatitis, the smallpox. All those vaccines are given to a children so that they can get immunized. So the next one in this curative function, we can say also that it provides the counseling and patient advice. So this also comes under this curative function. So it is a modern concept which has been adopted by the hospital, and it has been adopted by the big hospitals for the well-being of the patients. And during this counseling session, pharmacists educate people on communicable disease, then the epidemics and family welfare, etc. Not only the pharmacist, they, you know, the other members, the other health professionals also help to impart this education to the patients. Then we can say that the next function which a hospital perform is the training functions. So educational training, it is a secondary function of the hospital and concerned with providing training and educational courses for the professional and technical persons who provide health service. You know, this comprises of the physicians, the nurses, the dentists, the therapists, the pharmacist, everyone. So we can also say that this facility, particularly for medical students, pharmacists, and nursing, the medical technologists, like the DMLTs and the BMLTs, who have been studied these courses, who was the medical tech, the medical technologists. For them also, hospital provides a training function. And this also is in the curriculum of the syllabus, like in case of the pharmacist. So in diploma in pharmacy, if someone is pursuing diploma in pharmacy, it is must that he has to go for this hospital training. Without hospital completion of this hospital training, or training in any health services, maybe it's a maybe it in a hospital or in a primary healthcare system, anywhere where there are such all types of departments are there. So without that training, they won't be awarded the diploma degree. So this we can say as a research function, and we can say that many hospitals have like the aims, has been giving some various, or has been doing various researches in various fields. There are some other institutions also who has been performing some clinical trials that is also a research, and that has been functioning under a hospital. So we can say that a hospital is also functioning as a research work. So this is also a secondary function, and it also concerned with conducting the health related researches, and that focuses on the improvement of health and or prevention of diseases. So after that, we'll be coming to the departments, and here we'll be classifying broadly the hospital, and hospital departments are broadly classified, that is into the inpatient department and the outpatient department. So what is this inpatient department? So inpatient department, for your knowledge, you just for your brief knowledge, you get an idea that inpatient department is a department where a patient gets admitted, and this outpatient department, this OPD, is something where a patient visits a doctor, and he is like the clinics which has been established in a locality. This outpatient department functions it functions like that. So first we'll be starting with this OPD department. So what is this outpatient department? So the outpatient department, or the OPD, in this department, the consultation, investigation, the procedures, and specialty service have been provided to the patient. So consultation of whom? The patient, when a patient goes to a hospital, he visits a doctor and he consults a doctor. So the doctors, after consulting with the doctors give him some investigations to do, and that has been given in this OPD department. And then some procedures have been followed, how to do all those things, all those investigations and everything has to be done. And these all things has been done under this OPD department. Then, in this operative department, it helps in the preventive and promotion of the healthcare. So you will be seeing that, the immunization, as I've told earlier, that immunization is done in the OPD department. It is done in the OPD department, or there is a different section in this in the for immunization, that is a PP department. There is a PP unit is there in a hospital where where immunization is provided. But in some hospitals in the OPD's department, this immunization has been carrying out. So that prevents it. The thing which is written here, there's a preventive. It helps. It works like that. And the promotive healthcare. So how it works as a promotive healthcare, we can say that in the OPD department there are various type of programs which will be running, so that it promotes the healthcare system of a particular community. So there is also a rehabilitation. This is very important. What is this rehabilitation? It provides the rehabilitation service. So we can say this facility is provided by drug addicts. We can say for rehabilitation department, the service has been provided for the drug addicts. Then the chronic alcoholics and the psychiatric patient, by by specific theory and supportive measures like yoga and the advice and some medical advice. So this rehabilitation service is also been provided in the OPD. Then the health education, as we have said earlier, in the health education is a very important thing in case of our health education, in case of our hospital. So this health education is very important thing, and it is also provided in the OPD section. And the counseling. So counseling of a patient is done in this OPD section. So the next is the inpatient department, and in the inpatient department, we can say that in the inpatient department means that the procedures require the patient to be admitted to the hospital, primarily so that he or she can be closely monitored during the procedure and afterwards during recovery. So if I go to the previous slide, from this department, if these peoples are visiting to a doctor, some of them might be admitted to the inpatient department. So this is quite possible. So from the OPD department, some are referred to the inpatient department so that they can get, so that they can get admitted in the hospital. And after getting admitted in the hospital, they will be very closely looked after. They will be very closely monitored, and during the whole course of their of their recovery from the disease. So after recovery also, there will be a period of about 1 to 2 days where a patient is kept in observation, so that we'll see that after recovery how how a patient is, how the physiology of that patient is working. So that thing is also been monitored by the doctors. So let us come to the medical department of a hospital. So this is the medical department of a hospital, which is the primary department of a hospital. And we can say that in this department, there is a medical superintendent, is a doctor who has control over all medical departments. So there is a medical superintendent, or in many places he will be called as a hospital superintendent. So that man, or that guy is one who is who is responsible, or who is the control of the overall hospital. So the other so the departments of this so the other small departments of this medical departments include is the medicine, the pediatrics, the orthopedics, the skin, the cardiology, the psychiatry, the neurology. Various departments are there. So all those departments will be looked after by this medical superintendent. So then we come to the nursing services, or the nursing department. So the nursing department consists of nursing services and the nursing education. The primary aim is to provide comprehensive, safe, and well-organized nursing care through the personnel of the department. So this is about the nursing department, and we can also say that nursing is the vital prime and need of the healthcare system of a hospital. So it involves numerous activities ranging from general assistance to outpatients to the inpatients, and later on in the wards, the labor wards and the operation theaters. So it is one of the largest and an integral part of a hospital, performing around the clock, clock duty. So similarly to medical division, nursing division service has clinical specialties like medical, surgical, then the intensive care units, then the neurology. So like the medical divisions, like the doctors are been specified for specific departments. The nurses working in a hospital are also specified for the specific departments. So the administrator of this department is known as the HOD, or the superintendent of the nursing. Mainly, she is known as the nursing superintendent. Like in the medical service, we have seen the medical superintendent. In the nursing department, there is a nursing superintendent. So she is overall responsible for the activities of the department, and by virtue of her administrative ability, she is responsible for all those, she's responsible for the maintaining of this department. And she's responsible, the responsibility of the nursing superintendent is, to coordinate with all other departments and allotment of nurses required in a particular shift, then sending monthly reports regarding the activities of our own service to the director of the hospital, then maintaining the nursing record and quality of service given to the patients, and looking after the needs of our department staffs and arranging training programs for them, including fellow nurses. Now, in case of ICU and ICCU unit, a specific number of nurses are posted. She attends to an individual patient, closely monitoring them and handling sophisticated equipments. So apart from these two departments, there are also some other departments, and as we are the pharmacists, so here comes our pharmacy department. So pharmacy department, it deals, and this is responsible for purchasing, compounding, storing, dispensing of the drugs. So this department is mainly related to the drugs. The pharmacists are posted here are responsible for distribution of the drugs throughout the hospital. There may be in the OPD, there will be an OPD pharmacy department where there, an OPD pharmacist will be posted there with one who are visiting the OPD department. So they will take the medicines, drugs from this OPD pharmacy department, and then there will be some a pharmacy department will also be there in the inpatient department. So in the inpatient departments in different wards, there are pharmacy department, and they dispense the medicine to the respective patients after getting the advice from the doctors. So there are some other departments of the hospital that we have already said, that is the rehabilitation unit. So rehabilitation unit is all about someone who is about the drug addicts and those of the chronic alcoholic patients. They get some special type of treatment, either by yoga or some advices from the doctors, and so slowly they recover from their chronic diseases. Then there are some there will be a radiology department. So what is this radiology department? So we'll be seeing that radiology departments are the department that can be located in a place where there is a easy accessibility to the inpatient and the outpatient clients. So this department has following services, that is the X-rays, the ultrasonographies, the MRI, the ECG, the CT scan, and all the diagnostic things which has been done via rays are performed in this radiology department. So then there will be a paramedical departments, and this will include the laboratory service and the blood bank facilities. Then there will be a dietary department, and that will be responsible for the food service of the client according to their needs and the doctor's prescription. And then there will be a central sterile supply department where the department will be responsible for supplying of sterile articles throughout the hospital. And then there will also be another department, that is the medical records department, where the medical records are a complete documented data of the patient that has been kept in very precise manner, and that an individual patient data has been kept in this record department. And then there is also a department which might look very small to us, but it plays a huge function in a hospital. That is the housekeeping department. So the housekeeping department is responsible for to maintain the hygiene of the hospital, to maintain the to clean every corners of the hospital, then to provide the suitable uh, hygiene for every patient. So these things will be, the housekeeping departments will be responsible for these things. So to conclude this class, we can say that the hospital is a very complex organization with a specific aim of restoration and maintenance of good health. So in hospital, there are various types of departments are there in hospitals. So we have also discussed about the history of hospital, how in India, especially in India, how in the in the in the historical years, how the hospital has been run, and how the doctors were paid at that time. So we have also discussed about the various functions of hospital, how hospital functions as a preventive functions of hospital, then the curative functions of hospital, then about the training functions of hospital, then the research functions of the hospitals, and then finally, we have said about the different departments of the hospital. Broadly, we have given you the idea of the outpatient department and the inpatient department, and then some various other departments which are running in a hospital. So to end with, we'll be giving you some questions, and these are the questions, Mendy. So define a hospital, explain the functions of hospital, and write about the nursing and the pharmacy department of hospital. So thank you, class, for your attention. We'll be moving on to the next portion of our syllabus. So we have completed this about a brief introduction about hospital. In our next class, we'll be moving deeper into this syllabus, and we'll be completing various things, and we'll be seeing that various things about a hospital. So thank you again for your attention, and till then, stay safe.